Hello beautiful people, so today I'll be talking about vaginal discharge. We know we have normal vaginal discharge and we have vaginal discharge that is not normal, and I'll be talking about what is the normal color and what is a color that is not normal. What does it mean when you have a red discharge, yellow discharge, green discharge, white discharge, and even gray discharge. My name is Lois Odwor and I'm a nursing student, and on this channel I talk about nursing. I do health education, especially for mothers, and I also do vlogs. So if that is something you're interested in, you should consider subscribing. So the normal vaginal discharge should be slippery like the egg white, and when you look at it, it should be clear to white. And even when it's white, you know, at times when it's white it can be something else like candidiasis, but when it's white and there's no foul smell and there's no itching, then that means it's okay. So the first discharge is the white discharge, and for the white discharge is so common in candidiasis. And remember, for candidiasis, it's not sexually transmitted most of the time because it occurs when there's a change in the environment, change in the pH. And this occurs due to doing some things like douching, and it can also occur due to conditions like those who have decreased immunity, like those who have HIV/AIDS, those who have diabetes, those even who have cancers. They're at risk of getting candidiasis. And it can also occur for those who use antibiotics so much, like frequently, because remember, for antibiotics, when you use them too much, and you know the vagina has bacteria, the vagina has normal bacteria that are just staying there normally, so too much antibiotics will be able to affect them and they'll be able to cause disease. And even for those who are pregnant, like a very high percentage of pregnant mothers usually have candidiasis, and it is most commonly treated for pregnant mothers, like they're the ones who experience candidiasis the most. And it can also occur for those who use birth pills, they also have candidiasis at times. And then how it looks like is that it is a white discharge that is so thick, and in consistency it is so thick, and you also have like pain, especially during sex. So what happens is that if you have candidiasis, you should go see a doctor so that it can be treated, and usually treated most especially with the pessaries, which are some tablets, like things that are inserted through the vagina. And you can also have oral drugs, but what people usually forget is to treat the partner, because if you don't treat the partner and you go back into having sex with the same person, you'll be able to contract the disease again. Next, we have the gray discharge, and for the gray discharge is most common in bacterial vaginosis. And for bacterial vaginosis, most of the time it is usually asymptomatic, and maybe you cannot know, but later on you experience a fishy smell with the discharge and also irritation. So what you do is most especially avoid douching, and also make sure you seek for medical attention so that you can be treated. Next, we have the yellow to green discharge, and for the discharge here is usually mostly due to infections like gonorrhea or trichomoniasis. So how the discharge looks like is that it is thick, at times it looks yellow and green, and the symptoms that you'll experience is things like you have abdominal pain, low abdominal pain, and even pain during sex. So what happens is that whenever you experience low abdominal pain during sex, and the discharge is yellow to green, make sure you and your partner seek for medical advice, because the moment you alone seek for medical advice and you go back to the same partner, you're going to contract the disease again. Finally, we have the red discharge, and for the red discharge, usually most due to sexually transmitted infections like gonorrhea. So you'll experience uterine bleeding and also low abdominal pain. So if you experience any of these signs, make sure you seek for medical care. And also during pregnancy, if you experience any red discharge, make sure you seek for care, because if it's gonorrhea, you're going to transmit it to your baby, and most of the time when you transmit it to your baby, they're going to have problems like blindness, because the infection usually affects their eyes. So when you experience any of these discharges that I've mentioned today, be it red, white, gray, or even yellow, make sure you seek for help, because the more you're staying at home with this condition, just trying to self-medicate yourself, you're not helping yourself, and the infection can even advance and it can really affect you, because some of them are really like terrible, because when it gets to your uterus and such kind of things, it's going to cause a lot of problems on your reproductive health. So guys, thank you so much for watching this video. See you on my next video. Bye bye.